For those critically ill with COVID-19, ventilators are the difference between life and death. Several provinces have ordered more, but as Heather Yerkes West reports, there are concerns suppliers won't be able to keep up with the soaring demand.
We're ordering and we are taking all the strategies.
In Quebec, provincial health officials offered reassurance Tuesday that if patient demand on hospitals were to rise because of COVID-19, the medical system would not be short supplies.
We are really having a lot of help from companies, and so I want to reassure that we should have what we need.
Across the country, health systems are looking at how to expand capacity, particularly in intensive care. Italy has seen demand for critical care beds soar, and with them the need for ventilators. Health experts warn that if countries are unprepared, people will die.
Certainly in the more worst case scenarios, it could mean things like triage decisions around who gets a ventilator based on who is more likely to recover.
Several provinces have additional ventilators on order. Manitoba is awaiting 20, Alberta 50, while Nova Scotia has ordered 140 new units, a number that would increase its supply by 60%. But Canadian hospitals will need to compete for these resources with a growing global demand, and suppliers have warned they may not be able to keep up. It's why the British government has reached out to companies like Ford, Honda, and Rolls-Royce to help make health equipment. Canada's federal government is looking for help as well. The Canadian Chamber of Commerce CEO tweeting Tuesday, "Are you a manufacturer who can retool to manufacture critical medical equipment? If yes, the federal government wants to hear from you."
We need to mobilize all of the resources that we have in Canada to be able to respond effectively. So far, certainly what I've been hearing from members of the business community is that where they have the capacity to do so, they're glad to make their contribution.
Wartime-like efforts in the global fight against COVID-19. Heather Yerkes West, Global News, Calgary.
The new coronavirus has brought with it a desperate need for medical supplies like gloves and face masks to keep Canadians, but especially frontline healthcare workers who are extremely vulnerable, safe from contracting COVID-19. Tonight, our Ross Lord looks at how prepared Canada's healthcare system is and whether it has enough resources to cope.
This how-to video for Nova Scotia healthcare workers is aimed at simplifying personal protective equipment.
Now you've got your gown on and you've got your facial protection on.
The next video from the same health authority is troubling. Protective equipment is going missing from Nova Scotia hospitals at an alarming rate.
And what that means is that people are taking masks and other protective equipment out of the organization.
There are similar reports from other provinces, and the timing could not be worse. Masks and gowns can keep co-workers from catching COVID-19 from their patients, a possible source of infection in the case of a care worker at North Vancouver's Lynn Valley Care Centre. The federal government says it's pursuing suppliers of everything from masks and gloves to laundry services and IT support.
As well, of course, we're readying all those systems that we've talked about, the laboratory systems, the surveillance systems, protecting our health workers, very important.
The World Health Organization admits there's a global shortage of protective equipment that's leaving doctors and nurses dangerously ill-equipped. But provinces prefer reassurance.
And we're purchasing more personal protective equipment like masks, gloves, surgical gowns for our nurses, doctors, and personal support workers, as well as more ventilators.
A national union for nurses says it's not enough, insisting members need more say in their level of protection because methods like social distancing don't apply.
Have you ever seen a nurse or a healthcare worker do a treatment with over 2 meters? We're very, very close.
It's easier to agree on this point. For a country in uncharted territory, providing enough safeguards and using them properly will be a challenge. Ross Lord, Global News, Halifax.